My name is Cassie Capero, and I will be debating the pro side of next of kin or power of attorney should be allowed to override a patient's POLST when the individual can no longer make decisions for themselves. To start off, next of kin means a person's closest living relative. Power of attorney is a legal document that acts as an advance directive. It gives one person the authority to act for another person, and it's useful if you want somebody to choose medical treatments for you if you become incapacitated. A physician order for life-sustaining treatment consists of medical orders that are based on the patient's medical condition and their treatment choices as established in a conversation between the patient and healthcare provider. The form travels with the patient across all healthcare settings and helps doctors, nurses, healthcare facilities, and emergency personnel honor patient wishes regarding end-of-life sustaining treatments in emergency situations. Some things that should be included in each of these are cardiopulmonary resuscitation, or CPR, mechanical ventilation, tube feedings, dialysis, antibiotics, or comfort measures. The controversy surrounding the superiority of power of attorney versus POLST is simple. Some people believe that the person the patient appoints as their durable power of attorney should make the decisions for the patient when they are incapacitated because this is the patient's wish. Others believe that a POLST is superior to a power of attorney because it is agreed upon set of orders between the patient and the healthcare professional, and there is no personal feelings in the mix. According to the American Bar Association, the durable power of attorney for healthcare is more useful and versatile advance directive because it applies to all healthcare decisions and empowers the person you name to make decisions for you in a way that you want them to make them. So the person who a patient appoints as their durable power of attorney for healthcare is someone who the patient knew well, and they felt comfortable enough asking them to make decisions on their behalf if they're incapacitated. This is in opposition to a doctor who the patient may not even know or have a relationship with, and they're just filling a form with their end-of-life wishes. The relationship between a friend and family member is much different than that of a doctor. Think about if you talk to your doctor and your doctor asks you what your exercise regimen is like. You're probably going to exaggerate it, or if you don't exercise at all, you're going to tell them that you exercise. 81% of patients lie to their doctors about how much they exercise. So if patients aren't even honest with their doctors about something as simple as exercise, how are they supposed to make decisions about end-of-life care? Some believe that the POLST should be the end-all be-all in regards to the patient's wishes. However, there are two issues with the POLST. They're not always filled out by a physician, and a POLST may end up going against the patient's wishes. According to the Patients' Rights Council in Steubenville, Ohio, generally articles promoting POLST indicate that the form is filled out and signed by a physician after an in-depth conversation with the patient. However, this is not necessarily true. Few patients have personal family physicians with whom they have lengthy conversations about the topic, and often the person who actually fills out the form isn't the patient's physician. Doctors, nurse practitioners, and physician's assistants aren't the only individuals who can fill out the form. Others who actually discuss POLST with the patient and check off boxes in the form include chaplains, social workers, and others known as facilitators. For example, training programs for facilitators on how to have the conversation are carried out in a number of locations across the nation. Such training is open to healthcare providers, caregivers, and interested community members. The Respecting Choices program at Wisconsin's Gunderson Health System is a nationally recognized center for training and certification of these facilitators. A one-day program, if successfully completed, qualifies a person to become a certified facilitator, and then another additional day qualifies them to instruct others on how to be facilitators. Although a program spokesperson said that it's helpful if the facilitators have nursing or social work background, there's no educational or professional prerequisites for such certification. Finally, POLST can end up superseding a patient's wishes. If a patient has both a POLST and an advance directive, laws of some states, including California, require healthcare providers to honor the most recently dated document. In any unwitnessed doctor-patient interview, the physician has much more power as he or she checks off boxes on the POLST form and signs the orders. Rather than express the patient's wishes, the resulting set of physician orders could end up reflecting the physician's values or those of a legally recognized decision maker who has a conflict of interest. Some physicians also may be consciously or unconsciously biased. For example, they may write or rewrite certain orders so that they are consistent with the policies of the hospital and the institution that provides them with a place to make income. Bottom line, POLSTs can threaten the durability of advance directives. In conclusion, while they are safer, advance directives of power of attorneys still do not have the authority of physicians' orders. They should therefore be attached to POLST or similar forms. Combining both of these documents can achieve both the authority and the durability for the patient's wishes. Thank you for listening.